get used to the disappointment every month. You try and stay as positive as you can, but it's just so horrible every month trying to get pregnant and not getting pregnant. I definitely think it's the hardest thing I've ever had to go through, is trying to get pregnant.
Everybody, and welcome to the Ascension Journey. Today you are watching part 1 of my pregnancy and fertility series, and I hope you all enjoy it. So my husband and I started planning our first pregnancy in 2015. It happened all very quickly. We decided to come off the pill on my birthday, and it happened that month. Within weeks we found out we were pregnant. Because it was a planned pregnancy, we were just overjoyed. We didn't expect it to happen so quickly. We thought we'd be trying for a few months, so it was a very pleasant surprise when we found out that we were expecting. We were so excited. We told all our friends and family that same week. I probably was only about 4 weeks pregnant at the time, but we were just so excited. We wanted everyone to know. We told our best friends and our family members, and it was just a really, really amazing time in our lives. Now, around 7 weeks during my pregnancy, I started to spot. I'd never experienced anything like that with my first pregnancy, so, I got really worried and called my midwife, and she said, it's probably just some implantation bleeding, just don't worry about it, try and relax, and, everything will probably be fine. It's really common occurrence in early pregnancy. The next week, while I was at work, I started to bleed again, and I just started at a new job, and I didn't want to let anyone know. No one knew I was pregnant at the time, so I just really wanted to keep it under wraps. So I completed my whole shift. I went home and I just tried to relax and tell myself that everything was going to be okay. Now the next morning, the bleeding got worse, and I started to get pain as well. So we headed into my emergency department, and so then naturally everybody found out I was pregnant. I had my bloods checked, and my beta-HCG had dropped, which is your pregnancy hormone, which does suggest that your pregnancy is failing. I just knew in my heart that it wasn't going to work out, that it just wasn't going to happen, and that the pregnancy was going to end. So we confirmed fetal demise by an ultrasound, and I just couldn't look at the screen the whole time we were in there. I just knew that there wasn't going to be anything on the screen, and that there wasn't going to be any hope. So I just looked off into the distance and just cried the whole time. Miscarrying is such a strange feeling. You plan a whole life for this child. It was a planned pregnancy, so we had so many aspirations and so much we had planned for this little baby that hasn't even been born yet. It's a really strange feeling, grieving for something that you didn't physically grasp. And that grief stayed with us for a very long time. Didn't get over that grief until I'd become pregnant again. I don't think it's any different if you had an unplanned pregnancy and you miscarried, but I wanted this baby so bad. My husband and I both wanted this so bad, and it just was taken away from us so quickly. We couldn't understand it. We were good people and we did great things for other people. We couldn't understand why this was happening to us. So it took a long time for me to get over that lost pregnancy. I grieved for a very long time. It's really sad to think that I would have a 4-year-old child now. Yeah, it's really strange that could have been a potential for us. After that happened, we wanted to get pregnant again straight away, and we thought, I got pregnant so quickly the first time, it's going to happen so quickly again. So we got back into it. We tracked my ovulation, my cycles. We were eating the diets that they say you should be eating. We were taking folic acid, Alevit, and all that other stuff, just to be as healthy as we could, and to promote a healthy pregnancy. So yeah, we were like rabbits for months and months. And the first month it didn't happen. It's like, okay, it's all right, we'll try again next month. And the second month it didn't happen. It's okay, we'll try again. But then my period just stopped coming regularly. It was ranging from 20 days all the way up to 60 days. I just knew something wasn't right. I had a lot of pain during my cycle, like where I was hunched over in pain and I couldn't move. I couldn't bear for anyone to touch me. I was in so much pain. I also had a lot of pain when having sex as well. Like, it was unbearable. I couldn't even be touched down there. I had pain all in my uterus, ovaries, going into my back. Did see some GPs about it, and I had some ultrasounds done, and they're like, oh no, it's just probably ovulation pain. It's nothing to worry about. Just go about your day normally, and if you need any extra pain relief, we can just prescribe something for you. So at that stage, I just knew something wasn't right with me, and I knew something was wrong, and I did ask for a referral to see a fertility specialist or an OBGYN, and they refused. They said, no, there's nothing wrong with you. You haven't been trying to get pregnant for long enough. No specialist is going to want to see you if you haven't completed all these tests and done all of this stuff. And if you haven't been trying for 12 months, you're not even going to get a look in the front door. My GP gave me all these tests to do, blood tests and sperm tests and whatnot. And they said, oh, you know, your blood tests have all come back fine. I think you just need to try a bit longer. It can take up to 12 months for a healthy couple to become pregnant. And then it can take longer if you've miscarried. What else were we meant to do? But it just kept on going on for months and nothing was happening. My periods were so irregular. I tried acupuncture, and acupuncture did really help regulate my periods, and I went on Chinese medicine, and I tried everything naturally, Vitex, and you know, I did some diets to help me ovulate naturally, but it just wasn't working. And so I went back to a GP, and they said the same thing to me. No, it hasn't been 12 months yet. If it comes to 12 months and you still haven't gotten pregnant, then we'll refer you. But I just was fed up with that because I knew that something was wrong with me. I knew something wasn't right reproductively for me. So after failing to get some GPs to cooperate with me and get me a referral, I decided to just get one of the boys from work, one of the doctors from work, to write a referral for me. Literally took 1 minute of their time, and that's it. Referral to the incredible Dr. Dunn, who was completely and utterly thorough with all of our history in regards to our work life, home life, and how everything incorporated into the effect it had on our fertility. He took one look at all of my ultrasounds and all of my blood tests and just said, you know, you are not ovulating. This is why you're not getting pregnant. All of these tests are completely abnormal. You have massive hormonal imbalances, you produce too much of this hormone, not enough of that hormone, and ultimately it's causing you to not ovulate. Now, isn't that incredible that all these tests that all these GPs said were completely normal, completely fine, you just need to try a little bit longer, were completely abnormal in the eyes of a fertility specialist who has over 30 years of experience in his field? A big thing, go with your gut instinct, and you just can't stop pushing for what you know you need. So I tried a couple of fertility tablets, Clomid and Femara. They both have some really strong side effects. I felt incredibly sorry for my husband. I was a complete bitch. You get symptoms such as dizziness, nausea, vomiting, visual disturbances, and I experienced all of these as they upped my dosage each cycle. So you start on 50 milligrams and I ended up on 200 milligrams, which is a lot of Clomid, and I tried that for 6 months and it didn't work. So when that didn't work, we moved on to Femara, which is a drug that is used for breast cancer patients, and it suppresses your estrogen. I tried that for another 6 months. Now, I didn't get any side effects with that one, but it ultimately still didn't get me pregnant. So after a year on these fertility drugs and nothing was progressing, my pain in my reproductive organs was getting worse. So we did a investigative surgery of my reproductive organs, where they discovered I had lots and lots of scar tissue entwined between my uterus and my fallopian tubes and my ovaries, and they were adhering to my bowel as well. So just think of it as a massive clump of spider webs around my uterus and reproductive organs. Because it was adhering to my bowels, I used to get a lot of pain up my backside constantly, where I couldn't even sit sometimes, and I would huddle over in pain because it was just so painful. And all those fertility drugs I was taking were exacerbating that pain. So after that surgery, he was hopeful that within 3 months I would become pregnant naturally. He did try and clear out as much scar tissue as he could, but ultimately after the 3 months, it didn't work. My tubes weren't patent and I needed IVF. So IVF isn't as straight up as what some people would assume. It isn't just taking someone's sperm and getting an egg from a woman and you have a baby. Boom, it doesn't work like that. It actually takes a few people. It takes a mum, dad, a fertility specialist. It takes 2 embryologists and 2 fertility nurses for the process to run smoothly. Now, every single step in this IVF process is very meticulous and it's very structured so that everything runs smoothly to get the best possible outcomes, which in this case is to make a baby. So the whole IVF process starts with 2 weeks of stimulation, where you're stimulating your ovaries to produce follicles. In those follicles are produced eggs. So we want to get as many follicles as we can to produce as many eggs as we can. When we started this process, my doctor said to us that his goal wasn't to get us pregnant that cycle, it was to make as many embryos as we could so that we would never have to do that process ever again, because it's really strenuous on your body. After stimulating your follicles for 2 weeks, you get blood tests every day to make sure that you are not overstimulating, because if you're overstimulating, your body can go into complete and utter meltdown and completely shut down on you. Blood tests every day, ultrasounds, internal ultrasounds every couple of days to make sure everything was progressing as it should. Once my follicles were at the right size and there were enough of them, I had a beta HCG shot, and beta HCG is a pregnancy hormone, and that stimulates the follicles to release the egg within the follicle, not to release it out of the follicle. So after that, you have surgical removal of the eggs where you're put under general anesthetic, and your eggs are removed via a very, very long needle and catheter, which goes up into your uterus and then pokes out of the uterus and up into the ovary, and each follicle is poked individually, and each egg is looked at underneath a microscope to make sure that something is actually there. Each egg is then taken and put into separate vials and given to the embryologist. While you're asleep, your fertility specialist will write on your hand how many eggs he got out. So I had 16 on my hand, but there were actually 21, I think, or 22. Once they got back to the lab and looked under the microscope, they actually found multiple eggs. All the embryos are taken by the embryologist back to the clinic, and at the clinic your husband will meet the embryologist there, and they do the hard job of coming in a cup. That sounds gross, but that's exactly what it is. Once they have the eggs and the sperm, that's when the magic happens. Half of ours were done by ICSI, where they take 1 sperm and 1 egg and they physically inject the sperm into the egg. The other half were left to their own devices. 1 egg was mixed with 200,000 sperm and left overnight. So the next day, under the microscope, they look at each dish to see if any of the eggs are fertilized. The ones that don't make it the next day, they just discard, and then the rest they just keep growing and growing until they get to day 5. Some people will freeze theirs at day 2 and day 3 and day 4. Ours are all day 5 embryos. If they make it to day 5, that pretty much suggests that they're quite strong embryos and that they will make it onto a successful pregnancy. So after day 5, we had 9 perfect embryos, all top quality. So because my goal was never to get pregnant that cycle, I actually had to wait another 3 months after that, because I did actually hyperstimulate, and that's when your ovaries become really swollen and produce a lot of excess fluid, and that fluid can end up seeping into the free spaces in your body. After 3 months, when my hormones did regulate, we were able to put back 2 beautiful, healthy, high-grade embryos. So after they had put the embryos back in, literally a couple of days later, I started to feel so sick, like so nauseous from like morning all the way through to the night. I had to wait another 14 days after that to take a blood test to see if the pregnancy had taken. And then when I did have that blood test, it did confirm that I was indeed pregnant and had really high beta HCG and really high progesterone, which suggested that both of my embryos had taken. So at 5 weeks pregnant, I had an internal ultrasound to confirm my pregnancy, where they did see 2 sacs, and one was a lot bigger than the other. At my next ultrasound at, when was it? 11 weeks, hey? At 11 weeks, they confirmed that there was only one viable pregnancy. So we were incredibly lucky to get pregnant on our first go of IVF. We had a really, really good doctor, very intelligent, very patient orientated. He was really good with us and really genuinely wanted the best possible outcome for us. Now, when you hear that story of my journey, it doesn't sound all that bad. But what I didn't mention was that the massive mental health effects it had on me. I developed terrible anxiety and terrible depression to the point where I couldn't get out of bed in the morning, and I would just lay in bed all day and just cry and cry and cry. Hadn't gotten over my miscarriage from those years ago, and I felt like I couldn't be happy until I got pregnant again. So every single month when it didn't happen, every time I would get my period, I would just burst into tears randomly. I felt like the biggest failure. I worried that I was never going to be able to give my husband a child, that my daughter was never going to have another sibling. I worried that I wasn't going to be able to produce grandchildren for my in-laws. I just felt like a big failure. And I didn't know how to cope with that. I didn't know how to deal with my anguish and my pain and my grief. I didn't know how to navigate my way through that. A massive strain on my relationships with people because I didn't want to go anywhere. I didn't want to be around people. Anytime I would be in a situation with my friends, I would just cry about it. Every time I would hear someone get pregnant, I would cry. Because why wasn't it me? It did put a strain on my marriage as well because we were both grieving. We didn't know how to deal with our own grief, so we didn't want to put that on the other person. We didn't want each other to be exacerbated by each other's pain. When you are going through fertility treatment and you are suffering with anxiety and depression, you can't actually take anything for it. You can't take medications because it affects your fertility medications. But not only that, if you were to become pregnant while on antidepressants or anti-anxiety medications, it can actually have really detrimental effects on the pregnancy. So I wasn't able to take that route. I ended up just dealing with it internally and trying to process it all on my own. Fertility and trying to conceive literally took over my whole entire life. It's all I would think about each and every second of every day. From the time I would wake up in the morning until I would go to bed at night, my whole day was structured around trying to get pregnant and trying to do everything possible to produce a pregnancy. So it wasn't just as simple as going to a doctor and they made you a baby. There are lots of mental health aspects that come with it as well. I felt like I couldn't talk to any of my family about it. My two best friends were my biggest support throughout my whole journey. They were really there for me, and I really, really thank them so much. I would literally just cry to my best friends every time I see them about it because I felt like they're the only ones that I could really open up to. I didn't want to open up to my husband too much because I didn't want him to take on my grief as well as his. Finding out we were pregnant was the absolute best news. You just literally are waiting all day. You know the day, they tell you what day they're going to have your results, and you're literally waiting there the whole day for them to call you. And when they called me and said congratulations, I literally burst into tears and was crying nonstop the whole day. It was the most incredible moment of that prior 3 years. It was the most incredible feeling. And then when I called to tell my husband, I didn't even tell him in a cute way because he was working away. I literally just called him on the phone and was just in tears. I just couldn't even talk. I was that inconsolable. Finding out I was pregnant did heal a lot of that depression I was experiencing. But it didn't stop the anxiety because each and every day of your pregnancy, you just feel like it's just not going to last. And not that I wasn't positive about it, I really wanted to be positive about it, but I'd already experienced a miscarriage, so I didn't want to be too hopeful until after we made it past that 12-week mark. I literally had anxiety every single day of my pregnancy, thinking it wasn't going to last, thinking that the universe was just tricking me and that it was all going to be taken away from me at any given moment. It's so crazy to think of a life where our beautiful little Nalani didn't exist, because she has brought so much joy to our lives, and she has just completely healed us in ways we never thought possible. She is an absolute ray of sunshine in our lives. She's so incredible. And I think that is why I'm so clingy with her now, because I just love this little baby so much, and I really wanted her. We both really wanted her. She was well thought out, well planned. It took so much to get her, so now that she's finally here, I'm going to enjoy absolutely every single moment that I do have with my little tiny baby. Now, I have always been quite open about my infertility, but some people aren't so much. It's a really, really touchy subject for some people, but other people are receptive to the conversation. However, you just really need to keep that in mind when you are asking people when they're going to be having a baby, because we would be asked all the time, oh, when are you going to have a baby? You're married now, that's just what comes next. But it's really not easily obtainable for a lot of people, and it's a lot more common than what anyone would think it would be. Infertility, miscarriage, loss of pregnancy, it is such a common occurrence. So you literally have no idea what can of worms you are opening when you bring up that discussion to somebody. I started this channel because I really, really desperately love helping people, and I really wanted to be able to connect with other people through this platform. And I wanted to let other women and other men know, other parents know, that they're not the only ones going through it. And once you start talking about infertility, you don't realize how common it is, and other people are actually going through the same thing as you, people that you know. So I just want you to know that you're not alone, that if you need to talk to somebody, if you feel like you can't talk to anybody else, that I am here. I am happy to have a phone call with you, happy to meet with you one-on-one, and I'm happy to DM and private message if that's what you need. Mental health is such a big thing that we really need to preserve in order to live our best possible lives. I really hope that you enjoyed this first part of my fertility series. Next week we are going to be talking to my beautiful friend Ruth, who has had multiple miscarriages and lost a few babies as well, and we will hear her experience with pregnancy and her fertility journey. I'm really excited for this series because it's going to help so many people, and it's going to shed a light on such a taboo subject, such a subject that people just don't like discussing. So if you have any stories that you'd like to share with me, or if you'd like to feature in my infertility series, then please feel free to message me and we can meet up and discuss. I hope you all have a beautiful day, guys. Take care of your well-being and take care of your health. Mwah.